Thank you for joining us, and welcome to another edition of Answers Network. I'm your host, Allen-Cardoza, and for those of you that have been listening, sending in questions and comments, thank you so much, and please continue to help spread the word that this show brings on special guests that can inspire, educate, and in some cases entertain, while bringing answers and options to making our lives happier, healthier, and more successful. And remember, if you can't listen to this show live, you can go to our website, answers.network, and browse through a variety of heartfelt topics and pick out one that you feel works best for you. Now, I'd also like you to do me a huge favor while you're doing that. Please forward one of our shows to your social media group and to someone you know who can benefit from a particular subject. This is just one powerful way that we can make a positive influence in the world. Well, I can tell you that this is a subject that touches on all of us. Okay. So everybody knows somebody that is dealing with some level of health care. If it is not yourself, it might be your parents. And I just want to start out by I want to thank our guest and her patients' rights advocate company because healthcare price transparency is now law. And when we spoke a little over a year ago, I think we were still working on that. And while some healthcare organizations are still resisting, this is something that 90% of the American public wanted to see put in place, and she did it. Our guest, Cynthia-Fisher, is a life science entrepreneur, independent investor, and corporate board director. She founded WaterRev LLC to invest in novel technologies that enable sustainable practices in water use. She is best known for her pioneering work as founder and CEO of Viacord, Inc., a leading umbilical cord blood stem cell banking service, which she started in 1993. In 2000, she co-founded and was president of the cellular medicines company ViaCell, Inc. So she also holds an MBA from Harvard Business School and began her career in sales at IBM, focusing on healthcare, IT, insurance, and the defense industries. In short, she is someone who is working to make this world a better place for all of us, as well as our country a better place for us to live, and doing so on many fronts. Cynthia, welcome back to Answers Network.
Thank you, Alan. It's a pleasure to be here on behalf of patientrightsadvocate.org, which is
Yes.
our nonprofit, nonpartisan organization really focused on lowering the cost of Americans' health care by being able to have a functional, competitive marketplace in healthcare by a simple common sense factor to give all of us the power to know prices upfront before we get care and to be able to lower our costs through our choices as consumers.
Well, now in our last interview, you shared how new laws, were being implemented. I think about that time, and it was, as you said, to create transparency in healthcare. Can you describe how they have affected the system now? How much change have we gotten, and how much better has it really gotten?
Well, as of January 1st of this year, hospitals have been required by law. It's actually been in Obamacare for decades. Now that we've had Obamacare around, it was never made into rule of law. And it was made into rule of law during the last administration and embraced by the Biden administration. In fact, they even went further and said, we're going to up the penalties to hospitals to make them comply with this important law. And we're going to go after their anti competitive behavior of keeping patients in the dark and
Mhm.
employers who help purchase health plans for their hardworking workers to not know prices before they get care and get blindsided by oftentimes outrageous bills. And then I like to say, we're expected to pay with a blank check
Right.
because when we go to the hospital, they have us sign in that we'll be responsible to pay whatever they charge us. And yet they don't let us see the charges before we get care. Well, this is all to stop because of the law, which says all patients have the right to know the standard charges before we get care. And our organization has been fighting to make sure that right is delivered. January 1st, Allen, hospitals were to provide all of their negotiated rates with every single health plan and insurer they accept, and the discounted cash prices if you or I wanted to pay cash or from our debit card to pay for care. And cash prices should be much lower because they don't have to administer or come after with collections later. You get paid up front.
Right.
And in fact they are. And typically they're 40% lower than the insured rate. Well, what has happened is we looked last year actually this year, back in July, our organization, patientrightsadvocate.org, looked at hospitals across the country, looked at 500 random hospitals to look at how many were complying with this law.
Mm-hmm.
And unfortunately, we found that only 5.6% of the nation's hospitals are complying with the law showing their prices. And we looked at California. There were 8 hospitals in California, and none of which were in full compliance with the law. And some have posted information up, but they're still hiding behind curtains by not completing the data fields and making things non-obvious and hard to read because they're abbreviated or have asterisks or dashes, and it's sort of gaming this new law, which is just a shame because they're refusing to compete.
And one of the things I remember some years ago was, going in and asking how much a particular procedure was going to cost. It was something that it looked like I was going to have to go through. Fortunately, I didn't. But what I was told was, don't worry about it. It's covered by insurance. So is that still going on?
So often we have patients tell us, like yourself, oh my gosh, they tell me not to worry about getting the price because it's covered by insurance. Well, guess who insurance really is and who really pays for it?
Right.
We
We're
all
all
do.
paying for it.
It comes out of our paycheck. We pay for the premiums along with sharing those costs oftentimes with our employers. And those typically arrangements are either 60% paid by the employer, 40% paid by the employees, automatically deducted from our paycheck, that we forget that every paycheck is lower because of healthcare premium costs, or it's a 70-30. Employer might pay 70%, most employees pay at least 30%. And then we pay out of pocket with high deductibles in many plans so that we can have lower premium rates. And then we get surprised with outrageous surprise billing from the out-of-network doctors that have been doing balanced bills. Well, this is all to be put behind us and stop the overcharging and the price gouging by pulling back the curtains and letting these prices be seen system-wide. So the hospitals starting this next year, January 2022, because of the non-compliance, the penalties are raised now to $2 million per hospital for not complying with the law.
Good.
And it may need to go higher because some of these hospitals are reporting billions of dollars of earnings. Okay. And then they got over 200 across our country, over 200 billions of dollars in handouts, corporate welfare, when COVID crisis started. And so what we're seeing across the country, like HCA, the Hospital Corporation of America, that has public company, we're seeing record profits. Okay. 3.5 billion just in profits. Mass General reported in Boston over 15 billion with the B word in revenues. So when you start to see these nonprofits and for-profit centers being the crystal cathedrals of our states, many of them are the largest employers in the states because they're making so much money, right? And yet they can't spend the $11,000, $688 that was estimated by the government of the cost of posting their prices online. $11,000 post online. So next year we're hoping to see that the needle is moved and more hospitals show their prices. And then in July of next year, Alan, I'm encouraged because the transparency and coverage rule takes effect by law. And that's where every health insurer has to show every employer and all of us the actual negotiated rates that they have with not only hospitals, but wherever we get health care and wherever coverage exists. So that means we're going to start to see prices system wide, and companies are in the wings waiting to post and parse this data for all of us so that we can Google search or have nice mobile apps like we have for the airlines, right?
Mhm.
Like Expedia did and Orbitz did for travel. Now we have Google Flights and Kayak. And what we saw is when we got to see airline prices, and they weren't transparent back in 1978.
Right.
But since then, they are transparent. We get to see lots of competition. We get to make choices as consumers on quality and price in the airlines, and real prices have come down by 50% since they started posting prices in the airlines. So we think healthcare can get there and will get there. But I can tell you there's a big reluctance from the insurance industry, the hospitals, and pharma, and all the middle players that are capitalizing on us, all of us as patients, and our misfortune. And transparency exposes the greed and the price gouging and overcharges, and allows the winners to be those that provide the best value. And that's basically those that are being transparent about not only price, but quality
Right.
will earn our trust, as well as really best prices for the best care.
Are there any statistics that shows what it is actually costing everybody? And what I'm getting at is I'm trying to think of something that will get everybody more interested, because unfortunately, I think that thing about, don't worry about it, insurance is covering it. I think we have a large portion of people that go, okay, and that's it. But at the same time, if they understood that if it's costing, even if it's costing their employer more, if they go out, it's costing my employer more. If it's costing their employer more, if it's costing everybody's employer more, how much more are we paying for everything that we're doing? That we're paying more for milk, we're paying more for bread, we're paying more for our vehicles, whatever it is there any statistics that we can tell people that, look, you're still paying for it? I love the fact that you point that out.
Yes.
We're still paying for it. Other people at very, very high levels within these hospital corporations that are making billions of dollars and stuffing it away in other countries or in yachts or whatever it is that they're doing with it in, you know, uh, on Caribbean islands somewhere. That the only way that we're going to be able to do that is for everybody to join you. For everybody to say, look, we care, and you, Mr. Politician or whatever, if you don't, we'll put somebody in that will.
You're absolutely right, Alan. It is going to take all of us. And we're fortunate at patientrightsadvocate.org because we learn from employers and benefits consultants and patients all across the country. We hear from consumers. And the good news is that we've learned from employers that have basically taken the bull by the horns. That is, they've looked at insisting on, because
Mhm.
they are the fiduciary and they have the right to get access to actually their health claims data, to look at historical claims data of all their employees and say, and have it be confidential, but have a third party essentially take a look at that data and find out where the price gouging is happening, where they're overpaying for childbirth and colonoscopies or hip replacements, and then also look at creating their own network and their own pharmacy benefit program so that they cut out the many middle players that are capitalizing our misfortune in between and actually save those dollars. So let me give you an example.
Okay.
Osceola School District down in Florida had among the lowest teachers' salaries in Florida. And
Mhm.
they saw it as a huge detriment when they were covered by Cigna Healthcare and found that their premiums were going up almost double digits every single year for 5 years running, double digit increases.
Mhm.
Meanwhile, they couldn't raise salaries because the healthcare costs were just out of control runaway. So they found a benefits consultant that wasn't paid on commission with the insurance company and basically decided to look at the data and find their own way of contracting directly and saving their own money wherever they could and building their own network. What they found within this first year, rather than paying $75 million for all of their healthcare, they were able to save $6 million in the first year of running it by the numbers where everyone participated in this new way.
Mhm.
This is the second year. They have already saved $15 million this year. Those are real dollars that now, as they look to their future, if they're on par to save 20 million, 25 million a year, they can for sure start to raise salaries for the people who count. And that's the school teachers to deliver the best education and attract the best candidates. So that's one example in the public sector of how we see people making a difference. But we've seen businesses across the country that have said, game over, enough is enough. We've got to run these numbers like our supply chain, right?
Yep. Yeah.
We need to run it when we make a widget or a product or a service, we manage our own businesses by our costs.
Right.
And when employers step in to say, wait a minute, I need to manage healthcare because we hear things that Starbucks but so makes has to pay more for healthcare than they do for coffee beans, right? So when you see as an employer that you've got to manage those numbers, you certainly would watch every single price of a coffee bean. Now, when you look at prices from hip replacements to childbirth, to the cost of a strep test, you're going to want to incentivize and give incentives to your employees and bonuses to actually increase their wages so that when all of us participate in not only finding these savings and getting these savings in the best quality, then all of us win because it makes us more competitive to attract employees, keep employees with these higher wages and bonuses, but also allow us to compete on a global scale. And let me give you that example. These
Okay.
businesses are saving 30 to 50% by year 3 of what they were doing when they were just delegating healthcare to
Mhm.
letting the insurers manage and run it for their businesses. This is a big difference. It's a big difference. And price transparency throughout the system will help the employers actually allow us all to be consumers in the driver's seat, not only for coverage, but wherever we get care.
You know, we have a lot of teachers that listen to this show because they send us in notes and they tell us, which I appreciate greatly. Um, which I like to then task them sometimes. What I'm getting from you now is for them is go back to your go back to your union and tell
Yes,
them that with your next negotiation to get a greater salary, tell them that one of the ways that you can get that money is to change the way in which they deal with the healthcare.
absolutely.
Right?
And come July,
Yeah.
every single union in this country and every single employer, they already have the right to get access from the Blue Crosses, the Uniteds, the Aetnas,
Hmm.
all of the big health insurers across the
Yeah.
country. They have the right to get every single negotiated rate for every plan that they have. And they have the right to compare those rates across plans as well as get it for the historical claims data. So it's really starting, it's going to put some onus on the employers to actually look and analyze this data and help steer their employees to the best care at the best price to let them know where it is. But then it'll take all of us to be able to shop too as we get there. But look, do you think these insurers want this? No. And in fact, what we've looked at in some of these employer contracts, they have anti-steering clauses that you're not allowed to tell your employees where they can get the best quality of childbirth at the lowest possible price and have the lowest deductible. I mean, it's ridiculous. So employers in the C-suite need to wake up and smell the coffee. Drink some of that Starbucks coffee bean coffee to like lower their cost of healthcare because, wake up, look at those numbers and not sign contracts that basically harm their ability to save money for them and their workers.
And one of the things you mentioned is this affects our ability, uh, or American companies to be able to compete on the
Yes.
global market. Share some of the statistics in regards to what other countries, what or other employers in other countries are having to pay for healthcare percentage-wise, how it relates to what we're paying.
Yes, and let's look at the numbers. I mean, we're on target for all of healthcare as part of our gross domestic product and what we spend as a country collective in healthcare at being $4 trillion. $4 trillion, okay? And of that 4 trillion, in 2019 there was a Journal of American Medical Association article that said 25% of all of our spend in healthcare is purely administrative waste and fraud. If we can see it and we can pull back and shine the sunlight on
Right.
that administrative waste and fraud, that's 25%. So that's $1 trillion every single year that this country could save. And to answer your question about the percentages, currently we're at north of 18% spend of our gross domestic product of our economy. Most other developed nations are around 8 to 9%. So we're a little bit more than 2 times any other country that we compete with on the global scale for business and services. And that is a huge burden on the American worker and the American employers.
Yep.
Because when we go to sell our products and services, we have an inordinate cost in healthcare that's 2 times more than any competing business on the global scale. How do we compete? Well, you can imagine that when we pull back the curtain and have a foundation of transparency in healthcare and create a functional competitive market, that means making hospitals and insurance companies and the pharmacy benefit programs all across this country have to compete. Well, we will all benefit, and we should be able to, in time, be on par with the developed world to get our healthcare costs down. And I think we should shoot the goal to be in half so that we can be just like any other country. And obviously there's needs for broad access for everyone, but truly the government pays for over half for those on Medicaid and Medicare. We have many on the exchange plan with Obamacare, but the bulk of the rest, which is north of, it used to be 175 million, but I know jobs are down a bit in this country, but we're in the high 160 million people are covered by private or commercial insurance. And that's the American worker who's really carrying the load, because we are also the taxpayer that pays for Medicaid and Medicare. So we're paying for all of healthcare across this country for most individuals.
As you were saying that, the thought that came to mind and something I wanted to share with everybody is that, if you're talking to someone from the standpoint of telling them about transparency and why they need to get behind it, or why your your company needs to get behind it, or why your politician needs to make sure it's being, if they're against it, they're against transparency, and they're probably not in the right position. They need to be somewhere else. So don't vote them in, don't put them in. Get the people. We need the people. If there's corruption, it probably goes pretty high.
That's right.
And so start as high as you can get to make those changes. We have a question that's coming in, and again, I want to thank those that take the time to do this. This one reads, I tuned into your interview last year, and I've been anxious to learn more about the outcome. I read in the summary that some hospitals and facilities are stalling on providing pricing transparency. And my question is, who on the regulatory side is going to be making sure that they comply? And then my next question is, are there penalties for doing so? And if so, what are they? And by the way, this is from Melvin in Michigan.
Melvin in Michigan. Well, thank you for those excellent questions. Yes, the first rule in the law is for the hospital price transparency. And you're absolutely right. It's really about enforcement. because the hospitals have been gaming it and not complying as a whole. And the American Hospital Association, it's their lobbying organization in Washington, even sued the government to not show their prices. So that means they're making too much money on all of us because they're fighting so hard to keep us in the dark. So the enforcer is the Health and Human Services, and at the national level, and the Office of the Inspector General. So there is a website on Health and Human Services, cms.gov, where you can report your hospital if you're trying to get prices and they're not giving it to you or they're information blocking. You can go online to that site, and we'll make sure we make it obvious on our website, patientrightsadvocate.org. And we do report hospitals. And right now we're working on 1,000 hospital report that we plan to produce in January as our second semi-annual report on hospital compliance. And we will report all of those. But we encourage you to do the same, because the more Health and Human Services hears from all of us, the more likely they are to step in and enforce strongly, robustly, and maybe even raise those penalties. And our voice matters. So we do have active campaigns to write letters, emails, send your comments and your experience in. So you can go to patientrightsadvocate.org and activate. I also think it does, medicine is also local, and there's no, actually, it's quite helpful to also write the CEOs of your local hospitals and their board members. You can look up their board members online to say, it is a law for you to have the right to save your own money before you get care. Yeah. And let me give you an example. We know a woman who has 3 sons that have a genetic disease that causes them lesions in their brain, and they have to have regular MRIs, and they live in the Los Angeles area. She has a $10,000 high deductible plan. And the neurologist, she can get a local MRI, same quality, for about $450. And what she found by going to a major Los Angeles hospital, she was charged $7,500 just for one. And that ate up most of her high deductible, which she was hoping to have last the entire year. And why should she be overcharged by more than a factor of 10 times? It's outrage. And so when you can see these prices in advance of care and you can see the quality, then you can get the opportunity to lower both the cost of care and coverage, and even your coinsurance that goes along with that. So it's really amazing what we've seen. And in fact, if any of you have access to the Los Angeles Times, just reported this week that a nurse took screenshots in the operating room at Scripps Memorial in Encinitas of the Epic system, the software system that was tracking their use of supplies and what was happening in the OR. And what she showed was formulaically the cost of the sutures or the supplies and the upcharges at being some factor times 675%. Wow. Others at up 575%, and even one over 1,000%. Can you imagine that gallon of milk, that you're buying and not know until after the fact that the hospital might put a premium of 1,000 times on a gallon of milk? Alan, I don't know. What does a gallon of milk cost today? I buy oat milk. So I don't know what
I was just going to say, I do almond milk. So maybe it's about $3 or so.
So you're at $3, but then you could be paying $3,000 if you use the Epic system, upping that charge by 1,000%. I mean, this is outrage.
Well, but to me, it's criminal. And why isn't somebody is approaching it like that?
Absolutely. Absolutely.
Well,
the reason why highway robbery,
yes,
and what to you and me feels criminal, right? Yeah. Of way overcharging patients It's because they can,
Yeah.
because we've been blind to no prices,
Right.
as have our employers. But I'm going to tell you, I don't know one employer that would agree to pay 1,000 times more for pencils and pens in their supply closet
Right.
than their competitor for their employees. I mean, that's crazy making. And yet we do it every day in healthcare because we've sort of been sheep, herded into a corral without any power until now. We now have power, and believe you me, they're fighting it. They're trying to kill by delay in Washington. That's how they get rid of these rules of law, is they just drag their feet, kill by delay, and wait for people to enforce it. But all of us have a voice because it's our right, and this data is ours. It's ours to own, and it's ours to know.
Right. Okay. And again, let's go to the politicians. But before we do that, actually, I think we need to take a break. But so for everybody out there, we're talking with Cynthia-Fisher. This is something that affects everybody. And even after this show, go to patientrightsadvocate.org. Okay. And there's so much information there as to everything that you can do. So you can check that out. In fact, you can do it right now. Open up another screen on your computer right now while we go to break. We'll be right back. You're listening to Answers Network.
Founded over 30 years ago to meet the needs of families in crisis, West Shield has continually focused on resolving issues that negatively impact families and businesses. Our signature therapeutic transportation service helps to ensure that adolescents in crisis are safely transported to specialized schools, programs, and treatment centers with unsurpassed experience and success. We are supported by our full-service licensed investigation agency that has legally, professionally, and compassionately located hundreds of runaways and teens. We are experienced and qualified to help, offering solutions which may include referrals to our international network of top professionals in the fields of educational consulting, psychology, psychiatry, and investigations. Simply put, West Shield Adolescent Services and West Shield Investigations are the best solutions when your family is facing a personal crisis. Call 1-800-899-8585, 24 hours a day, 7 days a week. That's 1-800-899-8585, or visit our website at westshield.com. Thank you.
And we're back. We are speaking with Cynthia-Fisher, and we are talking about patientrightsadvocate.org. And this is something that everybody needs. And I had a thought, Cynthia, if they go to your site, do you have a list? If you mentioned that one of the ways in which they get around this is by doing nothing, meaning the bureaucrats, as far as the bill. Do you have a list of which politicians are dragging their feet or which ones are doing nothing?
Well, it's really the hospitals that are dragging their feet right
Well,
now.
no, I know the hospitals are, but
But yes, I think the key thing is this rule is enforced by Secretary Becerra, who came out of he was the Attorney General in LA, and he sued Sutter Hospital in Northern California for a big antitrust suit where they were way overcharging employers. And I think the suit settled for way over $500 million. And one of the things is that we're finding that this is happening across the country. So I think one of the things is that it's really up to Health and Human Services to enforce robustly this year and start issuing those fines. So I would say it's Secretary Becerra to just encourage him to start fining the hospitals and naming them publicly, naming them in the press. HHS has a big PR budget. There's no reason why they can't take out full page ads and show the hospitals in every market that are not complying with the law and therefore making healthcare costs too much for all of us because they haven't given us the power to know the prices before we get care. So there's all sorts of things, but I think putting the pressure on this administration and also in Congress to just let any of your local congressmen and women, as well as senators, know that we need them to get on the bully pulpit and make sure that we have robust enforcement and timely implementation of the insurance rule next July, as well as the hospital rule and drug pricing. We need to see prices everywhere we get care. It's an outrage that we're being way overcharged. And it's up to us to eliminate the price gougers, right? When we can shop, we wouldn't put up with paying $4,000 for a gallon of milk when we could get it for $4.
Yeah. We have another question with comment coming in. This one reads, 5 years ago, my father was diagnosed with lung cancer. He refused the radiation and chemo, but instead he used alternative methods and has been in full remission, as of this time. When we reviewed the hospital bills, there was consulting fees of $30,000 for 2 doctors we had never heard of. Apparently, my dad's doctor decided to cut his buddies in on a payout. I contacted the insurance company and demanded they refuse to pay these bills, which they did. I'm hoping your legislation will stop this sort of fraud and abuse. And this is from Helen in California.
Well, Helen, I'm so thrilled to hear that your dear loved one is doing well, having gone through alternative methodology for the lung cancer. I mean, that's the wonderful news. It's really about our health first. And congratulations to Helen for fighting what she had the right to do, is to not be wronged by tens of thousands of dollars, $30,000. And Ellen, unfortunately, Helen's case is not unique. In fact, we're seeing this across the country, is we've seen rampant fraud and overcharging. I'll give you another example to Helen's. A young man, Mason Cotchell in Colorado, went with a nut allergy to an emergency room. He got his bill months later, and it came in pieces, about $3,000 for going into the emergency room and getting a vial of epinephrine and some Benadryl. Okay. Well, that was expensive, tolerable. He had a high deductible plan of $5,000. But this is the worst part. They handed him an EpiPen on the way out and said, you now have a nut allergy. You should take this EpiPen. Okay. He gets the bill for the EpiPen. $15,000 for an EpiPen that had 2 weeks of expiration until it expired on its out date. Wow. Okay. So when he looked at, fortunately, this hospital actually did post his prices as well as others in the Denver marketplace. So when he came to us with this outrageous bill, we helped him look up the fair prices. Now, he found that he could have, if he gotten a prescription, gotten 2 EpiPens for $130 at a pharmacy nearby. Okay, $130 versus $15,000. Well, his insurer negotiated that EpiPen down to $4,900. That's still outrageous. Yeah. And when we helped him look up the pricing from the insured rate that he has in his plan, it was $600. And so both the hospital and the insurer way overcharged what was by right his negotiated rate. Still a very high negotiated rate and still 6 times more than he should have paid normally. But when they charged $15,000 and then the insurer overcharged, we found that both of them fraudulently, well, they called it erroneously, billed him. So Marshall Allen is a former investigative writer, much like you being investigative. And he just wrote a book called Don't Pay the First Bill. Don't pay your first medical bill. And is showing consumers how they can fight, even in small claims, these outrageous overcharges. And, it's worth it to speak up. It takes a lot right now because we don't have a binding price up front for the colonoscopy or the cancer treatment. And we know that's where we need to go. But in the meantime, people like Helen, thank you for what you're doing because you're changing the game. And like we said earlier, it's going to take all of us to step into our big girl and big boy boots and go fight the fight to save our own money. Because too many Americans have been devastated with medical debt, overcharges they should have never been billed. And it not only affects just that bill, but that changes their credit rating. And it's a factor in their car insurance rates because they add medical debt as a separate factor, not only your FICO score. So we're being slammed and crushed by these big hospitals and insurance companies. And it's game over when all of us step in and demand to be fairly treated and to know and see fair prices.
Mhm. And we have another question that kind of goes along the prior question. It touches on it a little bit. This one says, how can our government force us to pay astronomical amounts of money for health insurance and not allow us to use holistic or naturopath doctors and have it covered by the insurance? It is criminal, if you ask me. Is your organization working on this travesty? And this is from Robert in Los Angeles.
Well, our focus is to allow the medical community to be able to communicate quality, price, and outcomes. So the more the natural or homeopathic doctors, that includes DOs, chiropractor, etc., are
And
able to take the lead
mhm,
in being transparent.
yeah,
And many of them are transparent about prices, but post their quality and allow for outcome tracking as well. When you can see that someone does far better for their back care through chiropractic adjustment
yep,
and physical therapy than going under the knife and being changed forever. uh,
yep,
and let's see what going under the knife outcomes are comparatively to a first advance of looking at other alternatives. So when all of this becomes transparent, and we think price transparency will actually serve as the catalyst to show us just what is standard of care. What is standard of care for a strep test, for instance?
how
And
is that?
and what is standard of care for mammography or getting your PSA counts? So, when we get to see that, we can see not only um, how or what, but I'll give you an example. One can get a strep test from Amazon that will give you the results yourself. If someone has a sore throat, they want to know whether they need antibiotic or not, right? So
Mhm,
you can get it on Amazon for $17. Now in Boston, Massachusetts, if they don't know that that urgent care is an academic teaching hospitals like Brigham and Mass General, they'll charge them a $200 facilities fee for just stepping in the door to that urgent care. On top of it, they'll charge for the strep test, which we see about $120, and then a doctor's visit of sometimes as high as 425. So that whole doctor's visit to get a strep test could put them north of $600, $700, $800 when all they needed to pay was 17.
right.
Now the next part of standard of care is, well, what are the prescribed antibiotics that effectively work on streptococcus, right? And so
Mhm,
we should know that, and we should know what does that antibiotic cost comparatively in various markets, and can you get it? How can you get access to it, and where economically based upon your GPS location? And you'll need a prescription for that. So how much will it cost to get a prescription? So all of this standard of care, but you can imagine the doctor's visit could be saved if that person just got the strep test delivered to their door and found it was negative, right? And work through a couple of days and see if they felt better. So all of this can save us all money, but we have to know this. And price discovery ushers in quality, transparency, outcome, and then just what is standard of care.
So I just glanced over. We've got about 4 minutes, but what is next on your agenda, and how can people access your work, and how can people help you help us?
Oh, thank you, Alan. Well, patientrightsadvocate.org, we can help you by going to our website and you can learn how to shop. Mike Walls out of Texas walks us through how he shops, and he saved $40,000 on a surgery for tympanoplasty and ear surgery for his daughter. He got it for $5,000 versus over $40,000 from an opaque hospital by just getting the prices. So he walks you through how we can all shop in this
Mhm,
difficult environment when we can't see all the prices. The second thing we do is how to save when you've been overcharged or egregiously billed, and then getting access to Marshall's book, which is don't pay the first bill and go fight it. But then finally, how can you help us in Washington? Well, intermittently throughout the year, we have times where we need to bring all of Americans and consumers and patients' voices forward. So stay tuned. Keep on our site, patientrightsadvocate.org, and we will be having ongoing campaigns where you can use your voice, tell your own story, and let Washington know. And we will send the links that will go automatically based upon your zip code or where you are to your congressman and woman and Senate, as well as to this Biden administration.
And so if you're driving out there and you weren't able to write that down, we will make sure that we have Cynthia's website listed at ours at answers.network. Another question's coming in. I think we can squeeze it in. We moved to Tennessee during COVID and have heard horror stories about a state law that allows doctors to take medical control of patients who disagree with their doctor's recommended way of dealing with their medical condition. Have you heard of this? And if so, what can we do legally to protect ourselves from this happening?
Goodness, well, we haven't heard of that, but feel free to write us at info@patientrightsadvocate.org, and we're happy to investigate it further on your behalf with you and see what actions can be taken. But
All
feel
right.
free to write us anytime. If anybody has challenging bills that they're fighting, feel free to send it to us, or stories they want to tell, or even volunteer to do press, because it's your stories and your voice that is making an impact to affect this positive change.
Cynthia, I just want to tell you how much I appreciate what you are doing. You are making a positive difference in so many people's lives. And I hope everybody out there realizes, this is what this show is about. I want to give people like Cynthia a platform, and not because I'm doing something great, but because of how great she's doing by doing this for all of us. And if you were listening at the beginning of the show, you realize she's done a lot of things out there. So it's not like she needs to do this to make a living. She's doing this because she cares. And that's exactly why we need everybody else to get behind it. So again, Cynthia, thank you so much. And for everybody out there, please, go to the website, check it out. And this is something you can do that helps yourself, it helps your neighbors, it helps your family, it helps us all.
Thank you, Alan. And we're merely a conduit to bring all of your listeners' voices forward, because all of our voices do matter and are what is making a difference. So both on the positive stories of the savings that are being made, the demanding of the prices of the hospitals, but even writing letters to your hospital CEOs and saying that this is the law, they need to comply, and their boards, make it to whomever they have to report to too. This action demanding is these prices and also activating Washington is really helping us be able to save our own money. And it's game over when all of us take charge and get into the driver's seat to drive down the costs of both our care and coverage through us being in charge of our own health decisions, so we can live healthier lives at a much lower cost. So thank you.
Beautifully said. Thank you so much.
Thank you, Alan, for this.
All right. And for everybody out there, please be sure and join us next Monday when we are joined again by Robert Jensen to discuss his amazing new book. This one is Personal Effects: What Recovering the Dead Teaches Me About Caring for the Living. So think about that for a moment, and you may learn something that you didn't think you were going to touch on. And please visit our archives of past interviews at answers.network, or you can subscribe to the show through whatever podcast you listen to us on. And if you have a favorite platform that you use, if you don't find us, let them know that you want Answers Network on their platform, and we'll get that done. For everybody out there, please be good human beings and be with us next week on Answers Network.
Hello, I'm Marty Cove. You might remember me from roles such as Sensei in the Karate Kid films. I've done over 100 films and countless stunts in my career, and I've always given 100%. With the damage done to my body over time, I needed to find relief from my chronic pain. My passion for health and fitness drove me to find a natural way to combat muscle pain. Teaming up with doctors, detectives, and a compounding pharmacist, we've created Marty's Cobra Cove Ultra Strength CBD Cream. It's the only thing that has been strong enough to knock out my pain, and fast. Honestly, you may have tried the rest, but it's time to try the best. It's legal, it's safe, and 100% effective. Show your pain no mercy. Go to www.martyscobracove.com.
You're listening to Answers Network with Allen-Cardoza, only on LA Talk Radio.